Started. Welcome to the Virginia Heart Facebook Live discussion today on holiday heart syndrome. Thought this would be a timely discussion to talk about a not so uncommon heart condition that we see during the holidays specifically. Holiday heart syndrome is an entity first described in 1978 by a physician named Dr. Ettinger. And the condition occurs in folks that have been drinking a lot more alcohol than they're used to, and they tend to have a higher prevalence of or incidence of atrial fibrillation or other heart rhythm disorders. And the way it was coined in 1978 is such that it was called an acute rhythm disturbance or conduction disturbance associated with heavy ethanol. They called it ethanol in 1978 consumption in a person without any evidence or history of heart disease. So, what does that mean? So, someone without any history of heart problems, they have a new onset of a heart rhythm disorder after a heavy amount of alcohol. So, what they did is they followed a handful of patients and they saw that during weekends and holidays when they were having a lot more drinks than they would normally be used to, they would have a higher prevalence of atrial fibrillation to follow. And so this entity is an issue, an occurrence where a heart arrhythmia occurs after a heavy bout of alcohol consumption. Again, something that we will all probably imbibe in a little bit during the holidays, right? I mean, this is kind of the time of the year when this happens. A lot of holiday parties are occurring, and we get invited to these parties where there's, maybe more than one drink that's consumed, and maybe more than someone's used to. But it's unfortunate that sometimes, in some circumstances, in some people, that it could potentially cause some heart rhythm problems, such as atrial fibrillation, which would be the most common that we see. Interestingly, though, the arrhythmia does resolve when people tend to stop drinking alcohol. So, if there was a heavy period of alcohol use on a weekend after a few holiday parties, it turns out once patients come back to normal routine with increased fluids and nutrition and hydration, they tend to have less recurrence of atrial arrhythmias afterwards. And so there is a possibility that this is all reversible, and that's what we normally see. And one of the other aspects of this that is really important to understand is that it is not commonly seen usually in patients that are chronic alcohol drinkers. This is more so in people that tend to have maybe a handful of more drinks than they're used to in a shorter period of time. And so when we look at this, it turns out there's also a dose response relationship. And what that means is the more alcohol that is consumed, the higher the chance, the higher the likelihood of developing a heart rhythm disorder. So it may not be one or two drinks, it may be three or four or five or six for sure, and definitely with seven or eight drinks in a short period of time, especially in people that are not used to such heavy amounts of alcohol consumption. So it should be considered in anybody that comes into the hospital or the emergency department or to the doctor's office with a history of palpitations and they find a new onset of a heart rhythm problem, especially after a holiday or after a weekend. One of the first questions that should be asked, especially in a healthy person without a history of heart disease, is have you had any alcohol? So the key feature to understand here is that this is completely 100% reversible in these particular situations. Once a heart rhythm identification is made, we have patients tend to just stop drinking alcohol altogether, increasing their fluids and their electrolyte intake, and the potential risk for recurrence of the heart rhythm problem resolves completely. It stops, and patients tend to have normal rhythm thereafter. So, what about patients who have atrial fibrillation? What is the incidence, meaning how often does this happen and what occurs thereafter? Well, it turns out about 35% of new cases of atrial fibrillation can occur after a heavy consumption of alcohol. So that's a lot. So one in three patients that we see in the office for atrial fibrillation, especially in younger people, more so than older folks. In younger people, it tends to be related with some form of alcohol use in the previous 24 or 48 hours. So if we take that 35% of people that have had atrial fibrillation after heavy consumption of alcohol, it turns out about 63% of those, so now two-thirds of those folks, um, under age 65 most commonly will have atrial fibrillation but it will also dissipate on its own. So the point here is that this has been noted, it's been studied and evaluated, and it's well understood. Baseline elevation in heart rate is also a common problem. So if you have a patient or a person that has had alcohol, and we see them in the office, they tend to have a baseline heart rate in the office routinely around maybe 60 or 70 beats per minute. After alcohol consumption, even for just 24 hours, a heavy amount of alcohol consumption, the heart rates may raise by about 10 or 15 beats per minute. So that's significant, right? So if your heart rate is usually about 60 or 70 beats a minute at rest, now your heart rate's going to be about 80 or 90 beats per minute at rest. And what happens here is oftentimes patients will come in complaining of, an elevated heart rate. And this is not necessarily an abnormal heart rhythm problem, but their baseline heart rate has increased. So there's an interesting study done in 2015 in Germany, of course. It was called the Oktoberfest trial, aptly enough. And in the Oktoberfest trial, during the month of October, when, of course, young, healthy people are congregating in Munich, Germany, to consume maybe more alcohol than they're normally used to for the year, especially beer in Germany, healthy people were studied and followed and evaluated. And it turned out about 1% of all healthy people that were followed had atrial fibrillation. And so this was not uncommon. And so it's important.
Hold on, there's something wrong with the video. Go to the check connection.
Sorry, we're having technical issues here. Let's see real quick and make sure everything is okay.
It's freezing and unfreezing.
Really? Oh, shoot. Yeah, this is working.
Okay. Go back. There you go.
Hopefully everybody can see us here still. Sorry about that. Are we okay?
Yep.
Okay. So let me continue here. The Oktoberfest study, again, done in 2015. Researchers followed young, healthy people. These are folks that are usually between the ages of 20, maybe 25. So again, very healthy young people who are now consuming larger quantities of alcohol than they're normally used to for the first time, and they found about a 1% incidence of atrial fibrillation in these healthy people. That's a lot. 1% of this healthy population had a new heart rhythm disorder. And so, in general, though, that wasn't the only problem. They also found that these young people tend to have an elevated resting heart rate. So, 1/4 of the people that were followed, they had a baseline heart rate, let's say in the 60s or 70s. Again, their baseline heart rate was now in the 80s or 90s. And so there is definitely a relationship, it seems, between atrial fibrillation, heart rate elevation, and alcohol consumption. And the question is, how relevant is all this? Well, this was also analyzed, and you may have read about this in the Washington Post or in Time Magazine. There were articles about this in 2020. There was a study done in Australia where they found about 140 people that were followed that drink already routinely, about 10 drinks a week, were watched very carefully, and they had one group of that 140, so 70 people, stopped drinking altogether. So 70 people continued drinking, 70 people stopped drinking, and they followed these people continuously for about 12 months. And it turned out the people that continued drinking had a 73% increased risk of atrial fibrillation. Again, that's a lot. The control group that didn't have any alcohol at all after they stopped drinking had a 53% risk of atrial fibrillation. So it turns out if you cut out alcohol after you've had heavy amounts of alcohol, you will reduce your atrial fibrillation risk. And so this is really, really important. Again, this was in the New England Journal of Medicine. So what causes this? What's the cause? What's the implication here? How do we best assess this? And what are the treatment options? Well, the causes are twofold. One, there's definitely a direct effect of alcohol on the heart. There's no question about it. We talked about the elevation of the heart rate. We talked about heart rhythm disorders that can occur. But there's also an effect of alcohol on other known risk factors for atrial fibrillation. And we'll get to that here in a second. Alcohol by itself elevates our nervous system's awareness. You may have heard about the fight or flight response. Alcohol increases the awareness of this. There are hormones in our body that are stress hormones that are increased when we consume alcohol. Alcohol is also broken down into another metabolite called acetaldehyde that also increases inflammation and stress that also leads to atrial fibrillation. there seems to be a higher risk for arrhythmia formation in this particular population, and the threshold for an arrhythmia to occur is lessened because of alcohol. And as I said before, there is also a very clear cut dose response relationship, meaning the higher amount of alcohol you intake, the more likely there is a chance of developing a heart rhythm disorder. So the traditional risk factors that we normally talk about when we discuss things like atrial fibrillation include high blood pressure, coronary disease or heart disease, heart failure, diabetes, obesity, sedentary lifestyle, and sleep apnea. These traditional risk factors are all heightened, or the risks increase in people that drink a lot of alcohol. And so, because this also increases the risk factor incidence or prevalence, that also, of course, increases their risk of atrial fibrillation, despite alcohol not having a direct relationship, let's say, or on the heart tissue itself. But also, as you may have seen, your loved ones or your spouse or folks that are sleeping over after a heavy amount of drinking, they snore much more after they drink a lot more alcohol. And so snoring can lead to sleep apnea, which is another significant risk factor for atrial fibrillation. Alcohol also is an increased risk factor for hypertension or high blood pressure, and that itself is a risk factor for atrial fibrillation. So these things need to be watched very carefully. There's clearly a tremendous impact of alcohol on other risk factors of the heart, but again, it can potentially cause damage to the heart itself in a more intrinsic way. It can affect it on a more granular level, on a cellular level. And so there is a twofold process of how alcohol actually affects the heart in patients that potentially go on to develop heart rhythm disorders. What are some of the symptoms that we see in the office in people that have holiday heart syndrome? So let's say again, you're at a holiday party and you had a few drinks, and this is again a lot more than you're normally used to, and you go home, and at night when you're laying in bed, you feel like your heart's racing. Well, you may have something called palpitations. Palpitations is simply the awareness of your heartbeat. It could mean the heart rate's going very fast, or it's beating more frequently, even at a more modest rate in the perhaps in the 80 or 100 beat per minute range, but could be 120, 130 beats per minute. Again, that may be more of a sign of atrial fibrillation. If the heart rhythm is very irregular, or you feel like your heart's jumping out of your chest and it's beating very erratically, again, that's probably atrial fibrillation. But it can also lead to other symptoms as well, including shortness of breath. You could have difficulty with exertion. So, for example, going up a flight of stairs becomes a little bit more difficult or cumbersome. And then fatigue or generalized malaise or weakness, meaning not having energy to do daily chores. Even washing dishes or taking out the trash can be much more cumbersome. And so these are telltale signs that something is obviously not right. The heart's not beating regularly, and therefore it's not getting blood to your organs and your muscle and tissue like it should in a routine manner. And when that happens, this irregularity of your heart rhythm becomes much more prevalent and concerning. And this is what people seek attention for. It may not be because they know they're in atrial fibrillation, but it's because of all these other symptoms that they are having at the same time as well. What about the traditional workup for someone that comes into the office for holiday heart syndrome? What do we do as clinicians when we see these patients? It's fairly basic, but we need to check their blood levels for obviously alcohol, but certainly more importantly their electrolytes. The alcohol levels will come down once they stop, alcohol use, but electrolytes are important. And by electrolytes, I mean specifically potassium and magnesium. There's only one way you can get potassium and magnesium in your body, and that's by what you ingest. And so potassium-rich foods or magnesium-rich foods, which are plentiful in our diet, generally speaking, is reduced in high amounts of alcohol use. And why is that? Well, alcohol is something called a diuretic. A diuretic means it is a drug that can make you, unfortunately, you lose a lot more urine. We tend to go to the bathroom more often when we drink alcohol, and that's the effect on the kidney. And we also lose water when that occurs. So, you wake up in the morning after maybe a few more drinks than are used to, you may be dehydrated. A dry mouth, dry skin, again, that also leads to fatigue and weakness during the day. And so the low electrolyte levels that we often see with low potassium or low magnesium, unfortunately, increase the risk for atrial fibrillation. We see this all the time in the hospital for patients that get hospitalized for other reasons. If their potassium level is low or their magnesium level is low, they have a higher incidence of atrial fibrillation. It increases the risk of atrial fibrillation. And unfortunately, alcohol can precipitate that. The other, obviously, important piece of data that is required for these particular workups is an electrocardiogram or an EKG, or at least a heart rhythm strip to really prove that the rhythm is what we suspect it is. And sometimes an EKG will show us right then and there the patient's in atrial fibrillation. We can see this at the point of contact or the point of care, but we may send the patient home with a monitor to wear that they will certainly use and turn back to us, and we can analyze that data. As atrial fibrillation can sometimes come and go, they may not be in atrial fibrillation all the time. We may miss the opportunity to actually make the diagnosis in the office. But if we send them home with a monitor that lasts for at least 24 hours or even up to a week or two, we may find more recurrence of atrial fibrillation. And then lastly, an ultrasound of the heart, which is called an echocardiogram, is helpful. An echocardiogram is essentially a simple tool where we put jelly on the chest, we put a probe on the chest, and we take pictures of the heart muscle. And this is important because there is a risk of heart failure with atrial fibrillation and with alcohol use. And folks that have a high burden of alcohol intake, or they've had long-standing increased risk of alcohol intake, the risk of heart failure becomes unfortunately much more common. And so we have to look for that. Heart failure causes atrial fibrillation, and the corollary or the vice versa is true. Atrial fibrillation causes heart failure, so that needs to be ruled out. So that's the basic workup. And then the treatment. What is the most common treatment for this? Well, I already alluded to it before, but first things first, stop drinking alcohol. Certainly if you are at risk for this, and not everybody is necessarily, but if you're at risk for this and you've had an event before where you've had heavy alcohol use and you went into atrial fibrillation and this occurred again, stop drinking heavy amounts of alcohol. There are three other things to discuss when it comes to alcohol and heart rhythm disorders, especially atrial fibrillation. One is a heart rate controlling option. Number two is a heart rhythm controlling option. And then number three is blood thinners. Sometimes an anticoagulant is needed. And so, for example, if a patient comes into the office and they have a heart rhythm disorder like atrial fibrillation because of holiday heart syndrome, we may have to offer them a medication to slow their heart rate down, especially if it's going too fast. We also may have to give a stronger drug, such as an antiarrhythmic medication or a heart rhythm pill, to get them back to normal rhythm. And certainly a blood thinner is sometimes necessary because in some people there are risk factors for stroke. And so a stroke potential exists in folks that have atrial fibrillation. And so all of this is important. But one thing that we don't talk enough about is, well, if you are drinking alcohol and you have a risk for stroke and you're on a blood thinner, this is obviously a chance for potential trauma and bleeding to occur. Sometimes falls can happen if you're drinking alcohol. You can get injured from alcohol, and being on a blood thinner can really make this worse. And so we have to take this very seriously. We have to have a very strong conversation about abstinence and getting away from alcohol altogether to make sure we give medication safely. But there are risks and benefits to this. Shared decision making is important. We have to talk about this with our patients in detail to make sure they understand the risks. There's risk for liver disease and liver failure. And these are things we would want certainly our primary care associates and colleagues to help out with as well. If somebody has atrial fibrillation for more than 48 hours continuously after heavy amounts of alcohol use, it's necessary or reasonable, I would say, even especially if they're symptomatic, to do something called a cardioversion. This is a procedure where a patient would come to the hospital and we'd have to start a blood thinner on, and we would have to literally shock their heart or reset their heart rhythm switch back to normal. It's an outpatient procedure. It takes a few minutes to do, but it's under anesthesia. So we'd like to avoid all of those things, of course. And so how do we avoid all of this? Well, again, taking good care of yourself, being aware of the risk factors, and being very cautious, I think, is important, especially during the holiday season. What about the prognosis? What happens if you've had an event of atrial fibrillation after the holidays and you're worried about, well, what happens during let's say Labor Day or Memorial Day or 4th of July? Is this going to happen during every holiday that you have? Well, it turns out the possibility is yes. I mean, once you've had some atrial fibrillation, the chances of having recurrence of atrial fibrillation certainly exist. The trigger for AFib in this case is alcohol. So if you continue to increase your alcohol quantities and maybe even consider binge drinking on particular weekends or holidays, or for the Super Bowl or a game on the weekend, that will all increase the risk of atrial fibrillation. So we have to be aware of that. But remember, alcohol affects other things too. We talked about heart failure risk. We talked about liver injury. So the prognosis could be potentially significant and poor in some cases. And so we want to make sure that's addressed. But most commonly, termination of alcohol terminates atrial fibrillation. That's the key message I want to give everybody today. That if you had AFib because of alcohol use, stopping alcohol generally will stop the atrial fibrillation without any treatment, and that is the treatment. And so there is still about a 20% chance of recurrence, despite alcohol or no alcohol use, I should say, of atrial fibrillation recurrence in all people that potentially could have this entity. So in another study, just real quick, in 2013, we found that men had a higher chance of outcomes that were unfortunate, such as death or stroke or heart disease, with atrial fibrillation occurring after alcohol use compared to women. But still, in that case, if we stop alcohol use, those events were much less overall. There is this so-called U-shaped curve to alcohol consumption, and a lot of people have asked over the years, well, I'm told by my doctors it's okay to have alcohol, at least a glass of red wine a night because it's good for me, for my heart health. And that is true. A little bit is okay. But when you have too much, so a little bit is okay and that's safe, but if you have too much, on the other hand, there's a higher prevalence of risk. There is a sweet spot in between maybe for most people, and it may be less than two drinks or even one drink a night may be okay, but for some people even that's too much, and we have to tell these people to really abstain from alcohol altogether. Honestly, and this is the difficult part during the holidays to tell everybody this, there's really no safe amount of alcohol that you can take. It'll always, unfortunately, have some effect on your heart. It will raise your heart rate. It potentially can raise your blood pressure in some people. Some folks are just more sensitive to this than other people are, and so that's really, really important. But the key message there again is it is completely reversible. So if you do stop or cut down alcohol use, even from two drinks a day to one drink a day, you've had a significant impact on the risk of having recurrence of atrial fibrillation. So there are some unknowns here that we don't understand very well that come up not uncommonly in conversations with my patients. For example, a patient asks sometimes, well, is there a genetic cause to this? Am I more predisposed to this because of maybe genes that were passed on from my mom and dad? That's actually not the case at all. We don't have any data that show that genetics plays a role here. Really, this is just bad luck. I mean, it can happen to anybody. There is no reason why your friend who can binge drink on the weekends during football games has no AFib, and yet if you have one glass of or a cocktail on a weekend during a holiday, you go into atrial fibrillation. We don't have a good way to know why that is the case. Some people are just more prone to this than others are. And another question I get a lot is what type of drink can I be given safely without having to worry about atrial fibrillation? Can a glass of bourbon or a shot of whiskey or a margarita, with some chips and salsa cause this? And it turns out, yes, all of them. Wine, any form of alcohol is alcohol. Alcohol is ethanol. It doesn't matter what form it comes in, it's the same. And so if you are going to consume any form of alcohol that leads to atrial fibrillation, just know changing the type of alcohol is not going to make a difference at all. But there is a dose cutoff that is important, I think, to understand. For most people, that is. If you are a guy drinking less than 3 drinks a day on average, so not every day, but on average, you have less risk of atrial fibrillation than if you drink more than 3 drinks a day. For women, it turns out it's less than two. Sorry, ladies, but it's less than two for you. It's not clear why that is. There is a dose response, though, to this. Men just tend to be able to tolerate maybe a little bit more from a metabolism point of view than women can. But for whatever reason it is, it's probably 3 or less in guys and maybe 2 or less in gals. And so that's something to be aware of. But again, I would say as little as possible, probably. No more than maybe one, if that. So, what is the risk if a person continues to take alcohol on a daily basis over time? And does that risk outweigh the benefit that you are supposedly going to have, especially if it's red wine, right? Red wine tends to be the most protective, we think, against cardiovascular disease. Again, this is a controversial topic. There's no right answer here, but I tell patients that if you haven't had a holiday heart syndrome event, I think a glass of red wine a night is probably okay and maybe safe and maybe protective. But any more than that, probably not necessary. But again, if you've had atrial fibrillation, even with a glass of red wine, then that may be enough to potentially say you need to cut that down even further. So for you today and next weekend and the weekend after, what should you do and how do you prepare for the holidays? Well, this is something that we're all going to be challenged with as this weekend comes up and next weekend and the weekend after. Again, more importantly than all of this, if you drink, please drink responsibly. Make sure somebody is driving you home, number one. But number two, it's probably reasonable to cut down alcohol intake as much as possible and not overdo it. Also, hydration, 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 really, really, really important because when you drink alcohol, as I said before, this is a diuretic effect. It's going to make you lose more water through urination. And we all have to go to the bathroom more often when we drink. Dehydration is a risk factor for atrial fibrillation. And as I said before, another risk factor can be loss of electrolytes. You're going to lose potassium and magnesium. Drinking maybe potassium, magnesium rich fluids such as Gatorade or coconut water or something like that, should you have a prevalence of or incidence of atrial fibrillation, may be helpful just to get those electrolytes back in your system, and that may actually get you back in normal rhythm quicker as well. But there's a paradox here, and studies again show light to moderate alcohol consumption, as I said before, is associated with probably a lower incidence of heart disease. But atrial fibrillation, potentially can increase. And so we have to balance this out as much as we can. But if you haven't had an event of atrial fibrillation and you're safe from that standpoint, then having certainly one or two cocktails during the holidays at a time may be okay. But again, limiting this and doing as less as possible is better than heavy amounts, and that's important too. So that's all I have. And I think we'll pause here for questions.